You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our Razorcast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Peter Ferraro. Dr. Peter Ferraro is the founder of Ferraro Spine and Rehabilitation, a multi-specialty wellness facility serving northern New Jersey and the New York metro area for the past 18 years. He is voted as a New Jersey top doc for 2015. His advanced non-surgical approach to the treatment of many spinal conditions has awarded him numerous awards and accolades, but none better than a high success rate through his self-designed treatment protocol, the Ferraro Spine Method. Dr. Ferraro also is the Chief Clinical Officer of Optimal Wellness and Optimal Executive. These companies have given Dr. Ferraro the chance to be the Chief Wellness Officer of the NFL Alumni and Professional Basketball Association Alumni Wellness Challenges. Both of these events brought together sports alumni in a competition to achieve a greater level of wellness in their lives post-pro sports careers. Dr. Ferraro is widely considered to be one of the top chiropractors in the country, and he is also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, the Ferraro Spine Program and general chiropractic care. How are you today, Dr. Ferraro?
I'm doing great. Thanks for asking.
Great. Well, thanks for being here. And I'm going to jump right in. So for those of us who are just learning about your practice, can you break down the components of the Ferraro Spine Program?
Sure. The Ferraro Spine Program was created to offer the most integrative approach to conservative management of dealing with spinal conditions. So it's a combination of spinal decompression, chiropractic care, physical therapy, acupuncture, and nutrition, all working together as a team to effectively treat patients that are dealing with either herniated degenerative disc injuries in a non-surgical fashion.
Great. And we understand that everyone has different issues, and we're all unique, but what is the most common ailment among your patients? And what is the most often applied chiropractic technique that you use?
The most common ailment that we see in the office on a day-to-day basis are people just suffering from either a pinched nerve or some type of spasm where they're in pain and they're just not quite sure why. For myself, though, because I've been known for treating herniated and degenerative discs for so many years, we do have a lot of referrals from the orthopedic surgeons and neurosurgeons in the community that will refer to me a lot of their more severe herniated disc spine cases that the patient has either opted out of surgery or the surgeon is just trying to offer some type of conservative management before surgery. And so those are the patients that we see mostly.
Okay. And what type of technique do you find that's the most common for treatment? Or is every case just so unique?
At Ferraro Spine and Rehabilitation, our biggest focus is the individuality of the patient. So each patient, depending on exactly what's going on with them, will have a customized treatment plan purely just for what it is that they have going on. So we have an immense variety of opportunities, all from traditional chiropractic adjustments to some of the newer techniques that are non-forceful for those patients who are possibly intimidated about getting a chiropractic adjustment and for quote-unquote fear of the cracking sound. We make it so that we have instrumentation that we can use in a very low-force, non-invasive approach to offering corrective care to the patient's spine without having to have that fear. And for some who love the chiropractic adjustment and want to have the more traditional approach, we offer it all. And that, as well as the combination of using something called flexion distraction, which helps us to separate gently some of the neck and low back muscles, and of course our spinal decompression, which helps to shrink the size of a herniated disc without surgery.
Wow. Okay, great. And what sort of success do your patients see after regular chiropractic treatments with you? And how many months of treatments and therapy does it typically take to start experience relief for most people? Just so sort of a ballpark so people can kind of gauge, okay, if I do this for this many months, when should I start to experience some type of relief?
Different conditions require different periods of time, obviously, to treat. But if we're talking about those patients who are coming in because they have some stiffness, some pain, we'll initially start those patients on a multiple day per week session. And typically what I tell all my patients is what we try to do is start you off in an approach that offers you a series of treatments within a month. And then we will do a reevaluation at the end of that month to determine if those treatments have been as beneficial as we have thought. The goals that we have set, have we met those goals? And so that at the end of those, typically 12 sessions, we know pretty clearly if the goals we set are being accomplished, and if they're not, what can we do to effectively change that treatment plan? So typically I like to start an average patient on let's say a 2 or 3 time a week program for about 4 weeks, reevaluate them at that time, and determine the need for either another round of care similar to that or a reduction. But typically most patients feel some type of relief really within the first couple sessions, and then it just depends on the severity of their condition and whether or not we're dealing with just a sprain strain or a more significant herniated, degenerative disc injury.
Wow, that's great. Okay, so I did a little research on your website, and I see a list of physiotherapy therapeutic procedures, and I realize some of them I can't even pronounce. So at what point in your chiropractic care of a patient do you get to the point where you might recommend cryotherapy, diathermy? Again, these things I can't pronounce. Are there certain patients who benefit from these types of therapies more than others? And can you talk about maybe what these things are?
The physiotherapy therapeutics that we offer at Ferraro Spine are mostly gauged to offer pain relief. So we work those in conjunction with the more traditional chiropractic care or physical therapy that's more hands-on. We use these as an adjunct to what it is that we do manually. So, for example, the cryotherapy is a means to utilize compression and ice to help reduce swelling in a particular area. So let's say someone with a knee problem or an elbow problem, the cryotherapy with compression works fantastic. Some of the microamperage stimulation that we talk about and the nerve stimulators are really just that. They're helping to either increase muscle contraction or it's offering an opportunity for the muscles that are in spasm to relax. So really, all of these therapeutics work in conjunction with the doctors in our office and really are not meant to be used as standalone items.
Okay, that makes sense. Great. Okay, and then lastly, what can people do at home in between their chiropractic visits to improve on their conditions?
Some of the things that we see that are the easiest to do at home for patients are something as simple as just keeping hydrated. We give patients a formula of telling them, look, have a goal set for your water intake. Drink half your body weight in ounces of water per day. So if you weigh 100 pounds, you should be taking in about 50 ounces of water per day. And the analogy I give is think of the difference between a grape and a raisin. A grape is nice and plump, it's full of water. That's what your muscles want to be like, as opposed to a dehydrated raisin, which when patients are dehydrated, one of the main signs is cramping and soreness in muscles because the muscles are made up of 80% water. So certainly water intake is key. Good nutrition is important, as well as just staying on some type of exercise routine, whether it's just 15, 20 minutes a day of some type of cardio or a more aggressive, obviously, approach of doing some core stability or some functional training. But those things really do help patients in improving their symptoms and allowing their chiropractic care or their physical therapy care to actually work and last longer and really truly find the benefit in a more holistic way of living.
Okay, so thank you so much, Dr. Ferraro. We know you're really busy, so thank you so much for your time and help today.
Thank you. It was really great talking to you today.
Thanks. And for our listeners across the country, if you are interested in speaking with Dr. Peter Ferraro, you can either go online to www.ferrarospine.com or call 973-478-2212 to schedule an appointment. On behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.